My name is Amber Myers, and this is the assessment of the peripheral vascular system. First thing I want to do is wash my hands in front of my patient. I want to ask him his name and date of birth.
Robert Vetterbush, 8/25/77.
And I also want to verify that it matches with his wristband, and it does. Any allergies I should know about?
No.
Okay, the next thing I want to do is close the door, provide privacy for my patient, and then I want to explain the procedure. Hi Rob, today I'm going to be assessing your peripheral vascular system. I'm going to be palpating and inspecting parts of your body from your neck all the way down to your toes. Is this okay?
Yes.
Okay. Now that I've got his permission, I'm going to ask him a few questions related to the assessment. Has your skin been pale or blue lately?
No.
Has your had any numbing or tingling in your limbs?
No.
Do you have a family history of heart disease?
No.
Have you noticed your legs or feet swelling?
No.
Have you had any problem having an erection?
I have not.
Do you or anyone in your family have diabetes?
My mother, type 1.
Type 1? Okay. So the next thing I'm going to do is I want to assess my patient. I want to look for the color of his skin, make sure that he doesn't have any clubbing in his nails. So I'm going to check that by putting his fingers up like that, making sure there's a little diamond in there. And then I also want to make sure I press down and make sure the color returns to his nails within 2 seconds, and it does. So no problems there. After that, I want to check the temperature of his skin using the dorsal side of my hands on both arms to make sure that he is feeling normal, no pain, swelling, tenderness, temperature differences. And after that, I'm going to start with the palpating of his arteries. So the first artery that I'm going to palpate is his carotid. And so I'm going to find that on his neck. Then do the other side. Taking notice that the pulses on both sides feel pretty even, and on the scale of 1 to 4, they're about a 2. The next thing I want to do is grab his brachial pulses on both sides. And that's inside here. You gotta press down a little bit to find it. Good. Let me find it over here. And both of those are about even, no differences, and I would say about a 2 as well. And then finally we're going to get to his femur, or his radial artery. Okay. No differences in either sides, and I would say that the pulse feels to be about a 3. The next thing I would do if I were in a healthcare setting is I would palpate for his femoral pulses, but since this is a video and we were instructed not to do it, I'm not going to do that today. And then I would come down here and look at his legs, make sure that there's no swelling, edema, his skin's not dry, it's like a normal texture, and that I don't see any open lesions on his skin anywhere. And then I would come down and I would find his popliteal pulse, which is behind the knee here. And then on to the other side. And I take notice that their pulses are about the same, and about a 2. And then I would come down all the way to his feet, and I would assess his dorsalis pedis pulse on the back of the leg, ankle, and I would do that on both sides. I would also say those are even, and about a 2. And then finally, I would palpate the dorsalis pedis on the top of his foot in the first metatarsal onto the other side. And I would also say they were even and that they were about a 2. I would not say that I found anything abnormal. So when I'm done with this, I would document anything I found and wash my hands in front of my patient before leaving the room.